Our image of bloodborne diseases has sharpened in recent years. We know more about their transmission, prevention, and treatment. Take hepatitis B, hepatitis C, and HIV, the human immunodeficiency virus. Research shows that safety precautions, such as handling all blood and body fluids as though infectious, disposing of sharps safely, and using sharp safety devices, have decreased the numbers of exposures to such bloodborne pathogens, or BBPs. But healthcare workers fail to consistently use safety precautions. You can change that. We'll tell you how.
A sharper image. We know much more about the spread and prevention of bloodborne pathogens. We can work smarter, but we can't let down our guard. Let's take a closer look at the bloodborne pathogens putting you at greatest risk on the job. Hepatitis B, hepatitis C, and HIV, and what you need to do to protect yourself against them.
Hepatitis B virus, or HBV, causes serious liver disease. About half the people infected with hepatitis B have no symptoms. Those with symptoms may experience jaundice, fatigue, abdominal pain, loss of appetite, occasional nausea, or vomiting. Most people infected by HBV recover and clear the infection, but about 10% become chronically infected for life. Each year, more than 5,000 people die from related chronic liver disease and liver cancer linked to hepatitis B. As many as 200 of those who die are healthcare workers. The hepatitis B virus poses a greater risk to healthcare workers than either hepatitis C or HIV because it is more easily transmitted. As yet, there is no sure cure for hepatitis B, but fortunately, hepatitis B can be prevented by taking the hepatitis B vaccine. Hepatitis C virus, or HCV, causes a serious liver disease known as hepatitis C viral infection. This liver disease may cause symptoms similar to hepatitis B, but there are important differences between hepatitis B and hepatitis C. While 85% of people infected with HCV have chronic infections, only about 10% of those infected with HBV are chronically infected. In fact, the Centers for Disease Control, or the CDC, reports about 3 million people in the United States are chronically infected with the hepatitis C virus, while about 1.25 million are chronically infected with the hepatitis B virus. And remember, many people infected with these two viruses have no symptoms at all. That includes about half of those infected with HBV and up to 3/4 of the people infected by HCV. In fact, people who are chronically infected with hepatitis C may have no symptoms for up to 30 years. Yet during that time, the infection may be slowly damaging the liver. Hepatitis C is the leading indicator for liver transplants. Every year, up to 10,000 people die from hepatitis C-related chronic liver disease. Unfortunately, there is no vaccine to prevent hepatitis C. However, newly approved antiviral drugs have been effective in some people who have contracted this infection. HIV attacks a person's immune system and causes it to break down. The clinical picture of HIV infection differs widely from person to person. A number of those infected remain apparently healthy for many years. The infected person becomes seriously ill when the immune system loses its ability to fight infections. Some infected persons go on to develop AIDS. As many as 900,000 people in the United States are infected with HIV, according to the CDC. The numbers are rising among injecting drug users and women. The number of HIV-infected people who develop serious illness and who die from AIDS has decreased, thanks to the success of recent treatments. People with HIV now live longer and healthier lives. But yet, there is no preventive vaccine against HIV.
Hepatitis B, hepatitis C, and HIV spread most easily through contact with blood. They also spread through contact with other potentially infectious materials, or OPIM, including semen and vaginal secretions as well as any other body fluid or tissue containing visible blood.
You should know that OPIM also includes cerebrospinal fluid, synovial fluid, pleural fluid, peritoneal fluid, pericardial fluid, amniotic fluid, and saliva in dental procedures. OPIM also includes non-intact skin or organs from living or dead humans, and cell tissue or organ cultures and other biological matter from laboratory experiments. Bloodborne viruses are most commonly transmitted through sharing needles to inject drugs, or having unprotected sexual intercourse with an infected person, or from mother to unborn child before or during birth. At work, you can be exposed to these viruses if a contaminated sharp punctures your skin, or if blood or OPIM splash your broken skin or mucous membranes of your eyes, nose, or mouth. According to the CDC, needle stick injuries cause 80% of exposures to healthcare workers. OSHA reports most needle stick injuries occur when disposing of needles, including cleaning up after a procedure, when giving medications, when drawing blood, when recapping needles, or when handling trash and dirty linens. Occupational exposures have also occurred when blood and OPIM, such as visibly bloody fluid or concentrated virus in a lab, contacted the mucous membranes or broken skin of healthcare workers.
That's what we know about bloodborne pathogens. Now, let's shift our focus to everyday ways to protect ourselves. These techniques are proven to help guard you from infection.
Your facility's exposure control plan details BBP safety measures, including a method of identifying and evaluating safety devices, such as protective sharps. The exposure control plan, always available to you at work, is based on OSHA's bloodborne pathogen standard and CDC guidelines specific for healthcare personnel. Use your plan to protect yourself. Here's a snapshot of the safety precautions you should take. According to OSHA, immunization against the hepatitis B virus has proven very effective. In 1985, 12,000 healthcare workers were infected with HBV on the job. By 1995, after immunizations were promoted, only 800 healthcare workers were infected at work, and the number continues to drop. The hepatitis B vaccine is a series of 3 shots in the upper arm over a period of 6 months. Today's vaccines are safe and very effective at protecting you from getting hepatitis B infection if the series is completed. Protecting yourself with a hepatitis B vaccine is very important, but it's not enough. We lack vaccines to prevent hepatitis C and HIV infection, so you must follow these safety measures at all times. Standard precautions means treating blood, all body fluids, excretions and secretions except sweat, plus non-intact skin and mucous membranes as though infected with bloodborne or other pathogens. Standard precautions incorporates features of both universal precautions and body substance isolation practices. It protects you against the risk of bloodborne pathogens as well as other pathogens. Remember, all body fluids pose a potential risk for infection. To follow standard precautions, you must use barrier protection or personal protective equipment when you anticipate touching blood, body fluids, secretions, excretions, and contaminated surfaces. Personal protective equipment, or PPE, may include gloves, gowns, lab coats, face shields or masks and eye protection, mouthpieces, resuscitation bags, pocket masks, or other ventilation devices. Some tasks require more PPE, some less, and some require none at all. The point is, you should wear only as much equipment as necessary. Read your exposure control plan for details. Gloves are the most common type of PPE. Single-use disposable gloves that are low-protein and powder-free are used for medical procedures. Use heavy-duty utility gloves for some housekeeping duties. Gloves can be torn or punctured, so cover any hand cuts you may have before being gloved. They should fit snugly over your fingers and be pulled as far over your wrists as possible. Single-use disposable gloves should be worn only once, then thrown away. Always change gloves between each patient. If a glove tears, punctures, leaks, or becomes contaminated, remove it as soon as you can and discard. Never reuse gloves. Utility gloves may be cleaned or decontaminated and reused if not damaged, but throw them out if they are. Be careful not to touch the outside when removing contaminated gloves. Then wash your hands. You should wear a mask and eye protection or a face shield to protect your eyes, nose, and mouth during activities that may generate splatters of blood or OPIM. Wear a gown if you need to protect your clothing or skin from exposure. Use a fluid-resistant gown if you anticipate contact with large amounts of blood or body fluids, such as during childbirth. Wear a surgical cap or hood and shoe covers or boots when large amounts of blood may be encountered, for instance during surgery or trauma care. Be sure to use PPE when resuscitating a patient. Emergency respiratory devices and pocket masks isolate you from contact with a patient's body fluids. Make sure emergency ventilation devices are available where they're most needed, such as on crash carts and in certain patient and procedure rooms. Your facility will provide you with necessary PPE and train you to use it. Here are some general guidelines. Make sure PPE fits properly and check it routinely for physical flaws or damage. Remove an item as soon as possible if blood or OPIM penetrates it. Always remove PPE before leaving the work area. Immediately dispose of used PPE or have it laundered or decontaminated according to your facility's policy. Then wash your hands. Hand washing is your #1 protection against infection, and it keeps you from infecting other people or objects. Wash your hands after contacting blood, body fluids, excretions or secretions, even if you're wearing gloves. And wash your hands between all patient contacts to avoid transferring pathogens to other patients. Here's how. Wash hands with soap and running water for 10 to 15 seconds. Rub vigorously over all surfaces, including above your wrists. Rinse thoroughly. Then dry with a clean paper towel and discard. Now, using a clean paper towel, turn off the faucet. Your facility will provide a waterless hand washing solution if soap and water are not immediately available. Use it as a temporary measure only. You must still wash your hands with soap and running water as soon as you can. Do not use antimicrobial soaps or cleaning products for routine hand washing. These remove your skin's natural protective defenses and should be avoided. Many safe work practices are just common sense. You should not eat, drink, or smoke where you are likely to be exposed to blood or body fluids. Also, do not handle contact lenses or apply cosmetics or lip balms where exposure is possible. And never keep food and drink in the places where blood or OPIM are present. Never mouth pipette or mouth suction blood or OPIM. Always minimize splashing, spraying, and spattering when performing procedures involving blood or OPIM. Transport specimens of blood or OPIM in closed, leak-proof containers. Wear gloves and handle carefully. Now regarding contaminated patient equipment. Do not let it touch your skin, mucous membranes, clothing, other patients, visitors, or items in the environment. Make sure reusable equipment is not used on another patient until it has been properly cleaned. Single-use items should be discarded appropriately. Clean all blood and fluid spills promptly according to your facility's policy. Keep work surfaces and protective coverings clean. Wear gloves to handle contaminated laundry and be careful to prevent exposure of your clothing and skin. Place in an appropriate container in the area where used. Deposit wet laundry in a leak-resistant container. Trash may contain sharps or other infectious materials, so do not push it down with your hands or feet. Instead, gently shake down waste containers and carry waste bags by the top, away from your body. Dispose of blood and other regulated medical waste in appropriately labeled, closable, leak-proof containers. Follow your state's regulations as specified in your exposure control plan. And remember, fluorescent orange-red labels, red bags and containers, and warning signs are there to warn you that the contents contain blood or OPIM. More than 500,000 sharp-related injuries occur each year, according to OSHA. We're getting a clearer picture of how to prevent sharps injuries through research and technological advances. Safety devices now include needleless systems and engineered protective devices for needles and other sharps. Studies show that sharp safety devices may significantly reduce your risk of injury during procedures such as joining IV lines, drawing blood,